we are the H2H Network, and that is the humanitarian to humanitarian network. And what that means is all of the agencies within our network, there are about 55, we support humanitarians doing work within a particular emergency or crisis. And one of the areas that we are very focused in is community engagement, and another area is information management. And as such, we have, as of the end of January, we were tracking the infodemic and deciding which of our agencies would be best suited to support the infodemic that had been emerging back in January. So in doing so, the H2H Network, which is this collection of agencies, put together an activation back at the beginning of February. This activation was intended, we actually fund our projects, and so we did a fund activation. And what that does is it gives us the opportunity to use the services and the specialties of our agencies to support in a particular emergency. When we started back in February, we positioned the emergency in Asia. We did actually an initial call for proposals among our agencies and focused on the infodemic that was emerging in the Asian region. And so as such, we focused on agencies that are expert in community engagement, communication, information, and also accountability. The idea being that a package of these services together would work in an integrated way, both integrating themselves so that there is one, a greater than the sum of its parts, but also integrating very, very closely with other activities, actions, and other implementers out there doing work. So what we try to do is, sort of playing off of some of the things that Letitia mentioned just before me, is to sort of put into practice these very important aspects of social media in terms of understanding the disinformation, but also using social media in a positive way. That's one of the things we do. We also work on a scientific research database that is done by Evidence Aid and integrates with other research databases. We've also worked very, very, very much on content creation, and that's been spearheaded by BBC Media Action. And then also making sure that the information that we provide is in multiple languages and that there is some help in other languages in terms of terminology and glossary support. Importantly, as I mentioned, our initial activation was centered around Southeast Asia, including Cox's Bazar, but it also offers global and regional support. Our initial activation was intended to be through the end of May. Back in the days long ago, at the beginning of February, we believed that that would be a sufficient activation. We will be expanding that. Okay, I wanted to sort of focus on the sort of practical things that have been done through our package. And this is really just a snapshot of some of the things that we are doing. Happy to provide a lot more information, but basically, one of the things we do a lot of is integrate with other agencies. So to make sure that when they create very positive, factual, verified, validated information, that it's available widely and in many languages. So I point out the IFRC's piece on a guide to preventing and addressing social stigma associated with COVID-19, and the fact that TWB has been working with them very closely to make sure that that's available in as many languages as possible. That work is continuing. BBC Media Action is really putting in place the use of social media in a positive way. So both with Facebook, also with Twitter, they have created some fantastic localized content, mostly for Thailand, but also for Bangladesh and Malaysia. And this information is, actually the main thing they've done is putting together cartoons that are very accessible, very localized in terms of not being contextualized for the local context, and also available in many languages. Internews is conducting webinars for journalists in various languages and in various regions. This is actually done with WHO and with, I believe, with IFRC as well. The idea there being, as others have mentioned, traditional media needs to be one of the main conduits of factual information. And so local journalists often will struggle. They literally will struggle in discerning the facts from the fake news or the conspiracy theories. And these webinars are intended to help local journalists decipher information more carefully and to provide them with resources. We're having a glossary of terms coming out this week in the languages listed here. Those languages will be expanded. One of the big problems you have in an emergency, and in this emergency it's 10 times worse or 100 times worse, is on actual terms that are used by, say, WHO or by CDC or often by English speakers that are not easily translated. And this is really important for some of the sort of more marginalized languages, which are spoken really by marginalized populations. So how do you make sure that social distancing is properly translated? It needs to be understood by those who do not speak a world language. So this glossary of terms will be one of the key things that we will be building over time. And as I mentioned before, Evidence Aid does a research database. They have been doing this for many, many years for various epidemics and outbreaks, but they have, for COVID-19, they have worked very carefully every single day, putting on reviews and summations of research, and the research is really focused on the science of COVID-19, not on sort of some of the other things that people have said, sort of the infodemic side of it. It's not really, the reviews are mostly on the newest research out there, and give links to all of that research, but also importantly in many languages, so that they can, so that those who are doing research or need information in various languages can receive it. The final thing I have on this slide in terms of tips and resources is the Connect COVID-19 masthead for the newsletter that we put out every week. This newsletter is really about tips and resources and fact-checked information and dispelling information that is not true. They will always highlight a particular rumor that has been flying from region to region. As others have mentioned, a rumor can start in one place and morph completely into something else in a different language or a different region. That's all highlighted in that newsletter. It is not intended as a sort of awareness piece about what we are doing, but really as something that you can use. I've put the link there, and I certainly can share that more broadly. Okay. When I was asked to talk today, Tina asked me to sort of think about what the lessons that we have learned in this first, 8 weeks of work that we have done. And I think I really went out to the teams to try to get the sort of biggest pieces of information and what we've learned and what I think is going to be really important moving forward. The first is around local media. As I mentioned before, it's very hard to avoid fake news, and journalists need help. They need toolkits with validated information. They need content that's available in multiple languages and that they can trust. And they need training. So anywhere, wherever you are, please consider that whatever can be done for the local media is critical. Yeah, the infodemic on top of an infodemic. This is something that's really emerged in the last 2 to, I say, 3 weeks. And this is really, I'm talking here about the most vulnerable areas where there are humanitarian responses ongoing or humanitarian responses that have been halted as a result of COVID-19. What is happening is within the sector of the humanitarian sector, there is an explosion of information, explosion of efforts to give people information. These are all very, not all, but for the most part, by far the majority, are positive information, guides, and knowledge that people want to share. You know, we've gone from having 4 agencies involved in the infodemic and in COVID-19 to 36, and that's just within our network. So this explosion makes it really, really, really hard to know, to find information. Do we, is the best place, and also just to know where to focus our intention. Is the best idea to be on a WHO consultation call, or is it to be on a risk communication call? Or so it's just really, really hard to know, and that is just going to get worse. COVID-19 is a moving target. I think that as it shifts geographically. It will continue to do so. The messaging shifts, and we must adapt quickly. Rumors shift, and they morph geographically, as others have mentioned. I think what's really important here is we often lean on our agencies, and the work we do is really informed by other epidemics and other outbreaks that have happened in the world. Ebola being the one that all of our agencies have worked on. But this is not Ebola. And what is happening affects both the general population, or the most vulnerable populations, as well as the person giving the message. And that is really, really a different place. And it changes based on where you are in the world and based on where the disease is in where you are in the world. So what level are you at? Is it peaking? Is it flattening? Is it, where does it stand? Are people social distancing? So that has made things very, very difficult. Integration and collaboration are not just buzzwords. In the humanitarian sector, people like to say those 2 words all the time. I cannot emphasize enough how incredibly important they are. We must work together. Epi messages must be within communication messages. We can't attend everything, so we need to share everything. In the case of this consultation, I'm sharing everything back to our members. So we really need to help each other with that. We still need to know the local context. So while this is a global response, the guidelines on social distancing don't work everywhere, and we must adapt. How do you deal with it in Cox's Bazar, for example? How do we work with governments that aren't committed to factual information? So the local context and local language is super critical. One of the things that we'll see as things change is the literacy. The areas that will become more and more infected have low literacy rates. A lot of COVID-19 information is written. How do we shift that to visual and make it much simpler? And then finally, adapting to the new reality. So in the humanitarian sector, people, in terms of communicating, are used to doing face-to-face, and to ensure the best kind of communication. That's changing. We need to consider new guidelines for remote risk communications. We need to work together to figure out how we can deliver good aid remotely. And we need to support everyone in terms of information management remotely. And so there's a lot happening there that we haven't, that's not, completed yet. Okay, so I think my final slide and my final bit of information is just where we're going from here, and how our agencies that are experts in information management and community engagement and communications are adapting, and what they will be doing next. So, as I mentioned, we started in Southeast Asia. We did have a lot of focus on countries within that area: Thailand, Malaysia, Myanmar, Bangladesh, India somewhat. We are moving to a global yet local response, with a number of areas being our main focuses. Our focus will be on areas where there are weak health systems, or weaker health systems, and where there are possibly humanitarian crises already underway, or conflict. We're going to also expand the type of support we provide. So we're talking today about the infodemic. But we also will be expanding beyond that and really looking at information management and training and capacity building remotely to help humanitarians reach out and continue to try to do the good work they do, but on a remote way. And as I mentioned, the integration piece, we must continue to integrate. We must increase integration globally and locally, and just keep fighting that battle of sharing everything and trying not to duplicate efforts.